Yeah, hi everybody. This is the review recording for the micro final exam. This is Tuesday morning on the 21st. It may come in pieces. It just depends on if there's any other distractions as I'm doing it at home or the dog who I just took out has issues. But we'll see. So, nevertheless, after that clever introduction, I am going to start. So, I mean, it involves effectively four chapters, and uh, I think the focal points are the first three, which are genitourinary, skin, and respiratory, and a little bit on wounds because we do it the last week. And so, really, if you start with skin, what I've always told you is on the skin, the most common problem, although we see a variety of other things, but Staphylococcus is certainly the most common of all the species that are involved. So when we say staphylococcal species, it indicates it could be Staph aureus, Staph epidermidis, maybe some oddball that's part of it. It doesn't preclude Streptococci or Pseudomonas from being part of it, but we're seeing certainly an increase in certain areas. It just depends sometimes of what typically people are exposed to. But when I think skin, I think Staphylococci more than anything else. And there's so many, and the skin, almost any organ. I can't think of an organism or an entity that doesn't affect the skin that's there. So we have viral and fungal and protozoan and all of those things. So I think that's all part of it, to tell you the truth. And so pardon me for being distracted. So what I was saying is that bacteria, viruses, fungi, protozoans, I mean, any kind of entity can certainly, even though the skin is our biggest barrier, but it's still, basically what we've been talking about, a variety of different infections. And really the big problem we're talking about Staphylococcus aureus more than anything else these days is particularly its resistance to antibiotics. I mean, again, I emphasized the point to you before when we talked about antibiotics. Staph was so susceptible to penicillins and related compounds, and now 90% of them make some kind of penicillinase or beta lactamase, and immediately that limits your ability to find antibiotics that are there. And there's a lot of problems with there's some really oddball things like toxic shock syndrome, although it's very rare from just a common skin infection, that scalded skin syndrome you see in nurseries, and that's because of the. And again, I pointed out all the potential unusual products that it can produce. That's called exfoliating, and it's named, even though it's a toxin, it's named because of its exfoliating effect, just like that occurs on the skin and all, and underlying. Then you have to deal with all of the problems associated with burns, shedding that, the blistering fluid, electrolytes, secondary infections with other bacteria. And again, back, even though typically we see viral and fungal infections leading, being the precursor or setting the path for bacterial infections, this is an example of a bacterial infection laying a framework for additional bacterial infections with different or even similar bacteria. So you have to have, when you're dealing with infections, particularly, you have to sort of have your eyes wide open and not have tunnel vision, so to speak, about these different things. Let's see what else I can do. Okay. I'm sorry. I keep getting distracted by messages and stuff, even though I have my phone on silent. Impetigo. That's really interesting because it's applicable to both staphylococci and skin and streptococci. And particularly, what separates that is where it starts. Remember, it's the difference between a cold sore, let's say on your lip, as you saw in the illustration, and the skin itself. If it starts on the lip, it's a cold sore, and that inflammatory changes and problems associated with can spread to the skin. If it starts on the skin and happens to go towards your lip, let's say, because most of them are facial, now you're dealing with something that's most likely impetigo. It has that golden kind of yellow plasma appearance and crusts, and it's typically staphylococci the vast majority of the time, but sometimes it's Streptococcus pyogenes, and that's the ones that's associated with glomerulonephritis. That's applicable both to strep throat in the sense of respiratory diseases, and it's applicable, I think, more so to impetigo and skin diseases. So I think that's something to additionally keep in mind. We talk, I mean, this at least two parts of these 4 chapters involve words. So we all know what a word is. I, I made sure if you watch the progression of questions, if you think about them on the test, I immediately started talking about things like that relatively early on. Even when we talked a little bit about skin, and then I made a little bit more about it. We talked about viruses, and we know the word is a virus. We also know it forms a tumor. We know it's DNA virus. It enters the nucleus. There are certain situations and certain types of these viruses that can become malignant, and we're particularly talking about cervical carcinoma, which is the topic that's coming up this week. Again, remembering that when I'm talking about it for Wednesday and Friday of this week, which is which will be the 23rd and 25th when you hear me in class discussing this, and the fact that it, it is really relatively hardy in a sense because it's a naked virus. It survives well on surfaces. It's sort of the oddball when we started talking about genital urinary diseases, which usually don't survive well. This is one that does. And that's really the problem is why, in my view, warts are really basically everywhere. It's almost impossible to avoid them. And but certainly there's ways to deal with the genitourinary aspect of them and the problems they cause. But basically, they're all basically the same viruses, just the different types that you have to be wary of and the conditions thereof. So you also have to be aware. This is a chapter where this is the section, the final. We talk a little bit more about treatments, picking specific antibiotics and things like that. So, for instance, Staphylococcus, we all know it, the MRSA considerations, the resistance, the challenge with finding antibiotics. I talked at length about the progression of different choices you have to make, community acquired versus healthcare acquired. Here's the situation. It used to be a slam dunk for Streptococcus. Strep pyogenes used to respond all the time to penicillins, but even now we're starting to see resistance. And so, yeah, now you have to sort of broaden your outlook about things like this. So that's again why a lot of times the go-to have started to become different kinds of cephalosporins. Again, they have a broader range including gram positives and gram negatives. They're less likely to be deactivated by beta lactamases. Those were a couple of questions from the previous exam, and there's a reason for those to understand that. And certainly we have alternatives for people who are allergic to penicillin. Okay, and that's really part of the problem. I talked at length, and this is common with regard to all the chapters with yeast infections. Again, mostly Candida albicans. I don't have any questions on that new Candida auris that I mentioned in class and showed you some of that AI information that we did that relatively quick Google search to identify it. That's coming, but I think it helps you to be ahead of the game, particularly if you're in a clinical situation and you start to wonder, well, are we seeing a problem with this? Particularly in nursing, it tends to there's a fine line about kind of showing what you know without showing off. And for you, as you become more involved in the clinical process, you'll learn how to present those things. And it's very interesting. It's an acquired skill, so to speak. So there's lots and lots of different things that lead to fungi. I personally think moisture is the major part of it, but hygiene can play a role. Some people, their skin has hereditary problems. There's so many skincare products, and it's so easy to develop allergies to them. It's very difficult. I was talking in one of my other classes to really find out what they're supposed to publish all of the stuff, and they do, but it's not necessarily on the package. There's almost a point where you have to almost scan a QR code to find exactly what all the ingredients are in all of the products to make sure you don't have an allergy, or if you do develop an allergy, to get an idea which you have to be on the lookout for. So I think that's all part of the problem. Well, I talked at length about chicken pox and skin diseases. Not again, so unlikely that you would see it unless really the vaccination laxity aspect or a non-immunized population comes about. But you should know the cause, and the cause is fairly straightforward as to what it is. I was making a noise there. Let me check real quick, make sure nobody's clicking in on this, and why would they be? Doesn't look like that. I must hit a different button. but I digress. And so when you're talking about chickenpox, we all know it's a virus. This is, again, a lot of this is about herpes viruses, whether it's herpes type 1 or herpes type 2 or VZV. So we have to be familiar with chickenpox. You have to be familiar with this complication of zoster or shingles. And again, I don't know what else to tell you. By definition, it is really a process of a virus. It's really best defined as something that is a latent virus. It happens to present different. It's the same virus. It just happens to present differently when it goes from the initial stage to the latent stage. So I think it's a better way to describe it. I don't really consider it a recurrent infection. That would be like getting a second case of chicken pox. That just doesn't happen. Okay, it just does not happen. So I think that's part of it. Again, you're very unlikely to see a case of measles, but these days I think I would retract that statement given all of the outbreaks. I mean, the day I had that, and maybe I did send you that little article about it that was there. And all of a sudden I'm looking around news and I see, oh, most contagious disease ever. We have another outbreak. And there we are again. So depending on where you go, you may run into this, and it's relatively easy to spot and has potentially frightening complications that people just will not accept because they'll say, "Wow, Grandpa had measles and he's fine," that type of stuff. And and reality is to understand the names that I use: rubeola for measles, rubella for German measles. So I might use either term. I might use both terms, one or the other. So the terminology is important. That's why it's so vital to read the question and all of these things. Again, typically these viral skin infections and secondary bacterial infections, they itch. And obviously, we're familiar with the problems with rubella and the effects on the unborn child. I think that's important. And I mean, I can't stress all of that stuff enough. That's there. When we think about respiratory, understand there's nearly every possible organism in your respiratory system. Okay. Your mouth is a cesspool. So anything that's and not in your mouth, but all of our mouths are, any organisms that are in our mouth are also effectively, potentially can get into our respiratory systems. They can be gram positives, can be gram negative. They can be